Cancers of the mouth, throat, and neck are on the rise, but not in who you might think. Younger non-smokers are increasingly getting cancers once found in heavy smokers, and it's being linked to human papillomavirus, or HPV.
We are seeing much more frequently younger people coming in with head and neck cancers, and these people are not even smoking and drinking. These are people who simply have been infected with a certain kind of human papillomavirus.
According to the American Cancer Society, an estimated 45,780 new cases of cancer of the oral cavity and throat are expected in 2015.
Typical age for infection with human papillomavirus would be around the first time of any sexual activity. So certainly you can see sexually transmitted diseases, in children from 13 on. But the most common range is really in the 18 to 25-year-olds that we're seeing new onset human papillomavirus infection. What will typically happen is if you have an infection, it will stay in your body, and you are at higher risk for throat, mouth, and tongue cancers.
There are certain symptoms associated with the infection.
Pain is not a common thing with this. People sometimes will just notice a growth in a place where they haven't seen it before. They're brushing their teeth, and maybe they look at their tongue or their lip, and they see there's a little, what looks like a little wart there. Sometimes you can have bleeding from an abnormal tissue in the mouth. Sometimes there can be difficulty chewing, difficulty swallowing, hoarseness, any of those things, including a neck lump. If you come in with a neck lump and we find that you have something in the mouth, there's a chance that it may have already turned into something more serious.
And Dr. Parker says parents may want to consider getting their kids vaccinated.
There's a vaccine called Gardasil that is recommended for boys and girls when they see their pediatrician for visits, usually around the 11 to 12-year-old visits. We generally try to do it before there is any sexual contact, because once you have had sexual contact and potentially been exposed to human papillomavirus, this vaccine doesn't do anything anymore. Finding something early can really be the key. When someone comes in with something that's very advanced, it's much harder to treat. So the first sign of difficulty swallowing, hoarseness, coughing out blood, a constant tickle in your throat that won't go away, these are things that should prompt a visit to the doctor and potentially an ear, nose, and throat specialist like me.
Reporting in Norwalk, I'm Quadruba Croffey for It's Relevant News.